Hello everyone, my name is Mindy Panulo and I'm going to take you through a presentation titled Piloting Hand Hygiene Promotion Interventions in Primary Schools. So children, just like any other person, they are susceptible to infections and sometimes they are the potential transmitters of these infections, including COVID-19 that is still amongst us. Thus, preventing the spread of infections amongst children, including the school-going children, is very important because this does not only prevent the spread of infections in the schools, but also in the communities where these children come from. And an example to this is the provision of hand washing facilities initiative, which was done by the government of Malawi and its partners in response to COVID-19 pandemic. So the government of Malawi provided hand washing facilities in the schools to promote hand hygiene as one of the COVID-19 preventive measures. However, no specific hygiene promotion interventions or campaigns were attached to this initiative, which then resulted in low usage of the hand washing facilities. Thus, WASHTED, which is under Malawi University of Business and Applied Sciences, in collaboration with University of Strathclyde, with funding from London School of Hygiene and Tropical Medicine, designed a theory-driven intervention approach to promote hand hygiene in the schools. So the study was conducted in the southern region of Malawi in Chidziwisano district, and 108 primary schools were targeted through training one school health nutrition teacher per school. So the teachers' training sessions used participatory approach with practical demonstrations which conveyed the importance of hand hygiene. Using a step-by-step manual, the teachers then taught the learners in the schools the importance of washing hands in disease prevention through the use of games, demonstrations, and also activities. And an example to this is a paper game which was done with the learners to convey the importance of hand washing in disease prevention. And to promote sustainability of the intervention, schools were then using locally available materials. For example, with the paper game, instead of using paper, the schools were then using chalk dust, which is locally available in the schools. So during the intervention implementation period, the schools were then followed up twice over a period of 4 months, which was done by the research team and also the use of the primary education advisors, which are already tasked with the government to monitor school activities. Additionally, a WhatsApp group was then created which comprised of the research team and also the school health nutrition teachers. And this platform enabled the schools to share their experiences and also the challenges which they were facing while implementing the intervention. So following the intervention, we then realized or we observed an increase in hand washing behavior amongst the learners, which was evidenced by increase in number of hand washing facilities that were found per school. So during the first monitoring visit, on average, a school had 5 hand washing facilities, whilst during the second monitoring visit, a school would have about 12 hand washing facilities per school. And addition to this, we also observed an increase in number of schools which were able to put the hand washing facilities at a reasonable height, which promoted hand washing behavior amongst the learners. So despite these successes, we also observed challenges like lack of support which was given to the trained school health nutrition teachers. So the school trained nutrition teachers received little support from other teachers, which then resulted in them having a huge workload in promoting the hand washing behavior in the schools. And addition to this, in cases where the water supply was being shared amongst the community and also the school, there were conflicts whereby the children or the school learners were not given a priority to fetch water so that they could go back to classes. And most importantly, we also observed insufficient availability of hand washing facilities. As much as we observed on average having a school having 12 hand washing facilities per school. But in cases where children are coming from break time and they're going back in their schools and everyone wanted to wash their hands with soap, we saw that their hand washing facilities were not sufficient enough, and which also led to overcrowding the hand washing facilities. So in response to this, we then piloted a group hand washing facility which enables a number of learners to wash hands at the same time. So through this intervention, we then find that hygiene promotion, which targets schools, really needs to be context specific, and also they need to be practical, participatory, and also interesting, so that this should encourage behavior uptake amongst the learners. And most importantly, such hygiene promotion intervention should be included in the school teaching curriculum, so that each and every teacher should be responsible in promoting the hand hygiene. And most importantly, use of appropriate hand washing facilities which are able to accommodate a lot of learners at once are very important, because this maximizes the hand washing behavior amongst the learners. Thank you.